Hello, everyone. Once again, welcome all of you to this event. We are grateful and honored to have you all to this event. This event has been brought to you by My One Health in collaboration with Barakat Kaful Insurance and Dr. Khalif Abdifatah. So My One Health is a medical facilitator in Nairobi and also have other offices across the continent. We seek to assist patients get the right medical treatment with the right medical specialist and the right medical service. So we are honored to have Dr. Khalif Abdifatah, who is a neurosurgeon who has a special interest in neurovascular department of neurosurgery and is one of the only two neurovascular surgeons in Kenya. Welcome, Dr. Khalif, and please proceed and introduce yourself. And we have a presentation for this event, and afterwards we can have a Q&A session. So being that we've started at 1:05, we have approximately 55 minutes for this event. Thank you very much and welcome all of you. Dr. Khalif. Everyone, as we are waiting for Dr. Khalif to present, to give us the presentation, we have collaborated with Barakat Kaful to bring to you this event because we've noticed over the last years that we've had a lot of cases for neurosurgery. Some patients do not know where to start from or who to talk to when it comes to neurosurgery, ranging from tumors to other disorders that may present a lot of challenges when it comes to seeking the right medical treatment. So also traumas when you have an injury to the skull, and also if you have a disease on the brain or a disorder on the brain that you like to talk about today. So it will be open afterwards for questions. And I see Dr. is now ready to give the talk.
Time. My name is Dr. Khalif Abdifatah. I'm a consultant neurosurgeon. And today we are going to have a discussion about diseases of the nervous system. So we're going to discuss about the diseases of the nervous system. And this is a talk for the general public. We're not going to go into details. And if I go and do that, please stop me. If I say something that you do not understand, stop me at any point and ask questions. So the diseases of the nervous system are common. And it's one of the areas when it's affected, health becomes a big issue. And there's a saying that says, health is not everything, but everything without health is nothing. So the nervous system is a complex, and the diseases of the nervous system are life-altering because the nervous system controls every part of the body. I'm a bit biased, but I think it's the most important organ system because it controls everything. It determines your personality and who you are, and it's what makes you you. So, God forbid if you lose your limbs, you can still function, you can still talk, you can still have an identity, you can still have a life. If your kidneys fail, you can have dialysis or renal replacement therapy, or you can get a kidney donation from a relative or a friend or somebody else. If you had a heart failure, you can get a heart transplant. And if any other organ, most of the organs, if you lose them, there is a chance you'll still survive. And if you survive, you are still yourself. Unfortunately, for the nervous system diseases, that's not the case. If you lose your brain, there is no replacement. There is no surgery or procedure that will give you another brain. And if you survive some of the diseases of the nervous system, you might not be the person you were before. You may be alive, your heart is beating, but you are bedbound, you're dependent on others, and your life has completely changed. And that's why I say it's the most important organ system. This is a cartoon of what it controls and how big it is. This is what it is. It's the brain, the spinal cord, and the peripheral nervous system, together with something called the autonomic nervous system, which controls the internal organs. So your eyes, your ears, your taste, the feeling on your skin of cold and hot, vibration, everything, every item, everything that you perceive from the environment is through your nervous system. So the nervous system does control the entire body. So there are several diseases of the nervous system, and I'll list them, and then we'll go into them topic by topic bit. The first one is trauma, then infections, degenerative diseases, structural defects, tumors, and vascular disorders. So what are the signs and some of the symptoms of the diseases of the nervous system? So the different types of diseases that affect the nervous system also have symptoms, and some of the symptoms are shared. Like a patient with two patients with two different diseases could present with one symptom. For example, headache. A patient with brain tumor will present with a headache, and a patient with stroke will present with a headache, and someone with migraine will still present with headache. So these are some of the symptoms and signs of the diseases of the nervous system. With headache, you could have weakness or numbness on one side of the body or the whole body. You could have visual problems. You can't see things. So when you see double. You could have memory loss, loss of coordination, seizure, epilepsy, and speech impairment. So some of the diseases share some of the symptoms. So we go topical, and we start with trauma. Could you share the slides that you have? Maybe it's easier that way.
Let me share this slide with you, and we can move them bit by bit.
Yeah.
Can you see my slides?
Yeah, I can see the slides. You can move to the next. Yeah. And then next.
I still move?
Yeah. Yeah. New video you can play. Yeah. So it's a large organ system, and it affects the entire body. Every part of the human body is probably controlled by the nervous system, in direct or indirect way. So from your eyes to your hearing to swallowing to sexual function, everything is dependent on the nervous system. So it's a large organ system, and there could be many things that could go wrong when you have such a large organ. So next slide. Next. Yeah. So these are some of the diseases that affect the nervous system, and these are the symptoms of those diseases. Okay, next. And then next. Excellent. So trauma is a big issue. It's a leading cause of CNS disease. It's a big cause of mortality and morbidity in the world. And it usually affects both elderly and young people. It takes a huge public resource and it's more common in our countries, low and middle income countries. And what is the leading cause of this trauma? It's probably motor vehicle accidents. We have a lot of young people riding bodas, and they don't probably wear the helmets, or they drive at 200 kilometers an hour. They get into accident. One of the most commonly affected systems is the CNS, and they present with traumatic brain injuries. So you have a 25-year-old who has severe brain injury, who was healthy yesterday and today is in coma. That's why trauma is important. The trauma to the brain is unlike other organs. While it's easy to recover from a fractured bone or a severe limb, it's more difficult to recover from trauma to the brain. Next. And so the reason why this is important is the economic aspect of it. The amount of money that society spends on trauma is huge. The next issue that affects the CNS, or the nervous system, is infections. And what the slide you see is of a patient with a brain abscess, pus inside the brain. There's an MRI and an actual specimen of the patient's brain when the patient died. So this was a leading cause of mortality and morbidity in the past. However, now there is some improvement because of antibiotics. We could be able to treat these infections. Sometimes you can evacuate the abscess by draining through surgery. And the causes of these infections are varied: bacterial, viral, parasitic, prion disease. All these issues can cause brain infections. In the region in which you are, HIV is a leading cause of CNS-related. Could you go back? Yeah, CNS-related infections. So far we've discussed trauma, which is a big problem. Then the next is infections, which is caused by bacteria, viral, and parasitics. And there is some treatment for it because we use antibiotics. We can drain. So it's not doom and gloom the way it was in the previous centuries. Yeah, a lot of improvement have been made in the treatment of meningitis, of brain abscesses, and all those things. Next. So the next group of diseases are called degenerative diseases. And these are diseases associated with aging. There could be a number of them, which I've listed there, and you can see them. Alzheimer's disease and Parkinson's are the commonest of the degenerative diseases. They result from vascular impairment of the brain. The small vessels of the brain fail. And if you see at the image on the slide, on the right side is a patient with Alzheimer's disease, which is a neurodegenerative disease, and a control of a patient similar age with a healthy brain. And if you look at it, the brain of the patient with Alzheimer's disease is really, really diminished, atrophied, and it's disappearing. So these result from failure of the small vessels of the brain. There is aggregation and deposition of abnormal proteins inside the brain, and some of the brain neurons are susceptible to those diseases, especially the hippocampal region neurons. And those patients present with dementia or loss of function. Basically, the brain fails. So initially it starts with the person not being able to find where they kept their keys. And then it progresses slowly to the point where they can't know their name, which day it is, who is their relative. And we've seen some of those patients. It's really, really debilitating disease. So these are diseases of the nervous system that result from not infection, not trauma, but failure of the tissue itself. There is reduced blood flow into the brain because of neurodegeneration or vascular failure. Then there are abnormal proteins that are deposited inside the brain itself, which are toxic to the neurons. And sometimes some drugs are related with the development of these things. So it's a big problem, especially in the West, where lots of the nursing homes are full of patients with Alzheimer and dementia. So there are multiple of them. There's Parkinson's, where the patient has movement disorder, frontotemporal dementia, which is will have also movement disorder, but also will be agitated and violent. Multiple sclerosis, vascular dementia, depression, schizophrenia, degenerative spine disease, which is a big issue because now the spine basically fails. The nerves coming from the spine going to the legs get affected. The nerves coming from the spine go to the upper limbs get affected, and the person loses their ability to move. And next slide. The other neurological diseases are congenital defects and structural disorders. These diseases result from genetic defects. Some of them start while the baby is still in utero. There is closure of something called the neural tube. There is developmental malformations, which could be muscular and also structural, which leads to profound disability in children. I'm sure some of you have seen patients or babies with large heads where the head is full of water, and they require procedures to divert that water to somewhere else in the body. And those are special babies. They usually never make it to adulthood. They develop associated problems because they develop infections, because they can't swallow properly. Everything that is given through the mouth sometimes will go into the lungs. They develop contractures because the muscles are not working well. The joints are stiff. So those symptoms lead to painful manifestations of the joint issues. They could also get bed sores, or if you leave them on the bed for too long, they develop wounds that will now cause infections that affect the entire body. These are also some of the commonest diseases in our region, and they are related with poor maternal care, because in advanced countries where the health system works, these babies are diagnosed in utero, and some parents opt for termination of pregnancy because the defects are sometimes incompatible with life. But for our region, because of cultural, religious, and other legal issues, most of the patients are born with those defects, and they live to maybe sometimes 4 to 5 years with all the health needs that these babies will present with. So it's also a big chunk of the neurological diseases that we see. Next slide. So the other group of diseases are tumors. All the tumors that affect the human being or the body, 10% are related to this nervous system. So brain tumors, spine tumors are quite frequent, and we see them almost every week. They also present with high morbidity and mortality because, unlike other organs, resection or removal of these tumors is difficult. If you have a brain cancer, if you are diagnosed with a brain cancer, the chances of that being removed 100% are low compared to, let's say, if you have a lung cancer. If someone develops a lung cancer, the chances of curing it if the patient comes in good time are high. It's because you can resect the entire organ. You can live with one lung. Unfortunately, for the brain, that's not the case. If a patient develops a cancer of the brain, you can only remove part of the cancer. And if you try to remove the entire cancer, it will cause morbidity. It will cause more symptoms that the patient didn't have. And it's not recommended that now you cause more problem than you're trying to solve. So the treatment is very complex, and it's expensive because you require high skill and technicals. You also require ICU care. A lot of professionals are involved in the care of these patients, and that makes the care of patients with brain and spine tumors difficult and expensive. Next slide. The next group of diseases are strokes. These are patients who have vascular problems. The vessels of the brain rupture or clog, and that leads to symptoms. Fortunately, we have made strides in the management of these diseases, and if these patients present on time, there is high chances of cure. So strokes are mainly of two types. There is a type where a vessel gets blocked, and therefore the blood does not go beyond the blocked area. So that's called ischemic stroke. And if those patients present to us within reasonable time, within 4 hours, there are medications that are given to dissolve that clot and open the artery so that the brain gets perfusion of blood. If that fails, we still have other medications and procedures to treat it. We can actually remove the clot with a small pipe that goes inside the vessels and suck out the clot and reestablish flow of blood into the brain. So the world has made a big strides in the management of strokes. The other issue is hemorrhagic stroke. Now, the first one I've discussed is where a vessel gets blocked, but in hemorrhagic strokes, there is a vessel rupture. There's blood inside the brain. It's equally a lethal disease, and the treatment is also dependent on how fast you present. So if a patient presents with a ruptured vessel inside the brain and there's blood inside the brain, that blood is toxic to the neurons. It affects the functioning of the brain. It could cause seizures. So these diseases, the main challenge we face here is the patient presenting time. So it happens that a patient wakes up with a stroke, or people around him find that he can't move or can't talk. And then immediately after that, the patient is taken to maybe a local pharmacy or a small dispensary, or they are taken to their local healers, to the church, the mosques, and that causes a delay in the treatment of these diseases. Remember, time is brain. Time is brain. So the earlier you present to the hospital, the higher the chances of recovery. Even if we open a blocked vessel after 24 hours, there is no point, because the part of the brain which was dependent on that vessel will be dead by then. So it is an emergency. And if there's anything that I want to, any information that I want to share today most, is stroke and the importance of timely care, because time is brain. Next slide. So we've discussed some of the diseases of the brain or the nervous system. Then these are the people who take care of patients with nervous disorders. They include neurosurgeons who do surgeries for the brain and spine, neurologists who treat it with medications, neuroradiologists who are experts in the imaging of the patients with neurological disease. Psychiatrists are doctors who specialize in management of patients with mood disorders. Equally, psychologists, physical therapists, and occupational therapists help with movement and strengthening of limbs and muscles. And then speech and language therapists help patients with speech issues. So with that, I am very sorry I couldn't present the full slides. We had a lot of videos and photos. Unfortunately, there was some technical failure. And now I welcome questions with what I presented, if there is any. Thank you.
Hello, Dr. Khalif, can you hear me?
Yes, I can hear you.
Okay, so thank you for that insightful session. So I've been asked to let people see who I am. Yeah, so thank you very much. Now it's the time for questions and answers. If anybody has a question to Dr. Khalif, but there are a few that were submitted earlier that I'd like you to maybe address. Maybe you could talk about more about the importance of awareness, early detection. I know you've mentioned early detection for stroke, but also early detection for tumors. If that, what could it change in the aspect of the whole treatment, and also the importance of awareness, early detection, and management of neurological conditions. Maybe as we expect other questions to follow up.
Thank you very much. The diseases of the nervous system are a bit different from the rest. Some of them are insidious. They're gradual on onset and peak over a period of time. So, for example, a patient with brain tumor, why is it important that they seek help or find out what is wrong with them on time? It's because if you have a small lesion, small tumor, it's easier to remove. It's easier to manage. Unfortunately, if you present with the same tumor several months or years later, it will be more difficult to remove, and the cost and the complications are more. So if I just discuss some of the symptoms of brain tumors, these are not specific to brain tumors. So please, if you find any of the symptoms, don't think that you have a brain tumor. I'm not saying that you have a brain tumor, but if you have a headache that is constant, you have a headache that is constant and is worse when you sleep, which means you wake up with headaches, it's a good idea to seek help, to see a neurologist, neurosurgeon, and ask why you're having a headache, especially when you wake up in the morning. The other issue is if you are an adult and you've never had epilepsy or seizures before, and now you develop seizures, you have to find out why you're having seizures. It's not common for an adult to just develop convulsions. It's one of the symptoms that we see frequently in patients with tumors. So if you find that one part of your body is weak, let's say your left hand and your left leg is weak, it's a good idea to seek help, because that's also one of the symptoms of brain tumors and also stroke, but we'll discuss stroke in a different light. The other is if a patient can't hold their urine or stool, they lose control of bowel and bladder. That's also a big concern. And the reason is because the bladder and the bowel are controlled by the brain and the spinal cord. So those are some of the symptoms. For brain tumors, they're gradual on onset. They start slowly and build up over time. So some patients tell me that they like last year, they could walk, but they were sure that their left leg wasn't well. Then several months later, now it's paralyzed. The leg can't move at all. So it's a symptom that has been there. Coming to stroke. Stroke is one of those areas where we can treat. We can actually reverse the process. So a patient goes to sleep, awake, fine, everything's fine. They go to sleep. Then when they wake up in the morning, one side of the body is paralyzed. They can't move their leg. They can't move their arm on the same side, and their face is deviated. And they can't talk, or they can talk, but they're confused. That is a stroke until proven otherwise. The problem with our people mostly is now taking them to non-professionals, let me say, to faith healers and some people with some odd ideas that this is maybe devil's spirit or things that waste time. Okay, so I'm not saying those things don't exist entirely, but if somebody slept last night and they were well and today they can't wake up, it's unlikely that the devil came last night and slapped him. It's more likely that they have a vascular problem and they have a stroke and they need help. So the most important thing you can do for those patients is not to give them milk or not to put them in funny positions. Just put them in an ambulance and move them to the nearest hospital with stroke care. So you can take the patient to a hospital where the only people there are probably nurses and some few doctors who are not stroke specialists. Those patients will not get help. So the best chance is, and the data has proven that patients who are treated in stroke centers almost always have better outcome than patients who are treated in peripheral primary care centers. So when you see a patient with symptoms of stroke, and symptoms of stroke, I'll elicit them again, is confusion, inability to speak, one side of the body is weak, please take them to the nearest hospital with stroke care. The reason is, if you take the patient there and the vessel is opened on time, the patient will walk out of the hospital because there is still brain to be salvaged. The brain is not dead yet, it's just ischemic. There is no blood to it for several hours. But if you reperfuse it, the patient gets better and they can walk out of the hospital. If, on the other hand, you wait at home, you do all the things that our people do, and then present to the hospital 3 days later, there is nothing that can be done. That patient is going to be permanently disabled. If they were a driver, they can never drive anymore. If they were a farmer, they can't do anything. So my appeal to everyone listening is to have the awareness that stroke is an emergency care, that it can be treated on time, and that there are places in the region where that can be treated safely, effectively, and cost that is affordable. Thank you.
Thank you for that, Dr. Khalif. That was very insightful. So maybe to just update our listeners that if you have any question, you can type that on the chat. But also, there's another question we could, Dr. Khalif, you can talk more about. You've talked about getting the right people when you have stroke, or the right specialist doctors. What resources are available more so in East African region? Do we have enough specialist doctors in terms of neurosurgery? Do we have enough diagnostics for these neurological disorders, so that our listeners can understand that when this happens, you can visit certain institutions? I know we partnered with different neurosurgeons in Kenya, in Uganda, across the world, and also facilities. But what resources do we have as a region to help the early detection and early treatment commence as soon as possible?
Yeah, so thank you for the question. So healthcare professionals are scarce all over the world. It's not only a problem for East Africa or this region. Every country in the world has a problem or shortage of healthcare professionals, except with few cases, maybe Japan and South Korea. The latest data that we had, every other country in the world required more neurosurgeons than they have, or neurologists than they have. So human resource is scarce, and it's a big issue for our region. That's the first thing. So, for example, in this country where we are, Kenya, there are around 35 neurosurgeons in the country. Unfortunately, 90% are in Nairobi. So the rest are in Eldoret, Mombasa, and Kisumu, and that's it. So it's a huge deficit in terms of the human resource. That is changing slowly. There are more people getting trained and getting into the field. That's the human resources. The other issues that are needed, or the other things that are needed, are the technology required to investigate and treat these patients. Fortunately, a lot has been done about that. And now, almost in every county, there is a CT scan, at least in Kenya. There's a CT scan where these patients can go and get the correct diagnosis, okay? Because when you have a stroke, you have to differentiate. Is it a problem of vessel getting blocked, or a problem of a ruptured vessel? And you can only do that by doing a CT scan. Unfortunately, CT scans are available in the country. In almost every county, there is a CT scan. Every county headquarters hospital, there's a CT scan. So once that diagnosis has been made, and the patient is put into the line for ischemic or hemorrhagic, then the treatment is diverse. The treatment is different. Fortunately, again, in the country, there are enough cath labs to open those vessels. The issue is there are very few centers doing it. There are cath labs available, but the human resource to do it is not very, very widespread. So for now, I know in Nairobi you can get something called thrombectomy, that's opening the vessel, if you present to some hospitals. Okay, not all hospitals with cath labs can also do that. So it's a big issue. There is a problem of human resource and there's a problem of technology, but it looks like the technology is now getting solved slowly. So with that, I say, if you find that a patient has a stroke, the easiest thing you can do is just find out stroke centers in Nairobi or stroke centers in Mombasa or stroke centers in Kampala, and you'll be able to get help. Thank you.
Thank you very much, Dr. There's another question here. To feel comfortable, we urge our listener to go to the Q&A section and maybe address their questions there. There's a question here that says, thanks for the presentation, Dr. I have a patient who often feels tingling feet at night. He is non-diabetic, but has high blood pressure, which he manages by taking prescribed drugs. What could be the issue, and please advise on how he can contain the tingling feet in regards there. So this is a question from somebody in Timilele, and he says, yeah, I have a patient who often feels tingling feet at night. He's non-diabetic, but has high blood pressure, which he manages by taking prescribed drugs. What could be the issue, and please advise on how he can contain the tingling feet? I think this patient has a lot of discomfort.
Okay, excellent question. So that is just one of the symptoms of the nervous diseases. The commonest cause you've ruled out is diabetes. Patients with diabetes get affected. The fine nerves at the end of the nervous endings of the skin get disrupted because of the high sugar in the blood, and they develop what you just described, a tingling sensation in the feet. Some patients complain about hotness, some complain about numbness. So for this patient, even though we don't know the age and what are the circumstances, that is a nervous disease issue. Some of the commonest causes of patients who are taking high blood pressure are the drugs called calcium channel blockers. Sometimes they cause retention of fluid, especially in the lower limbs, and they develop swelling in the lower limbs. And that swelling sometimes is associated with a tingling sensation, even though we don't have all the details, but that could be one of the reasons. The other possibilities are degenerative diseases of the spine. So if the patient has back pain, disc bulges, like in the event that these discs sometimes move and compress the nerves that go down to the legs, and now those present with symptoms of lower limb pain, numbness, and tingling sensations. So it will not be easy to just pinpoint this patient with the information that we have that this is the right diagnosis and this is the right treatment. No. So we evaluate the patient wholesomely. Could it be caused by the drugs they are taking for hypertension? Do they have some sort of vitamin deficiency, especially vitamin B complexes? Do they have skin disorders? Do they have a lumbar spine disease? Those are all the questions that you need to get answered before you can pinpoint and say, this is the disease and this is the treatment. So such patients, if it's causing such discomfort that they can't sleep at night, it's a good idea they seek help to the nearest neurology and neurosurgical centers. What can you do to relieve those symptoms? We know some patients get help with probably dipping their feet in warm water before sleeping, and especially if the patient is in Nairobi right now because of the cold temperature. Okay, so sometimes we prescribe physiotherapy, massages that do help relieve the symptoms, but it'll be difficult to say that specific patient with the information that they have, that they're just hypertensive and on medications and tingling sensation, to pinpoint exactly what they have and do. But it's a good idea if they can seek help in the nearest facility. So when such patient presents, we evaluate them entirely. So is it localized only to the feet, or they also have upper limb symptoms? Is the skin intact? Do they have lumbar spine disorders? Do they have back pain that radiates to the lower limbs? Is there urinary dysfunction? Is there sexual dysfunction? All those things need to be evaluated before we diagnose and treat the disease. Thank you.
Thank you very much, Dr. for that. And just for the information of our listeners, we can arrange for an appointment with Dr. Khalif here. If you are outside Nairobi, we can always arrange for a teleconsultation with the doctor so that he can get more information about this patient and advise appropriately. We understand that, as Dr. has mentioned, there are few in outside Nairobi that can help. So we are able to assist with teleconsultation with such patients. The next question is, what are the effects, both long-term and short-term, of alcohol consumption on the CNS, or the central nervous system, I suppose?
Okay, excellent question. Also a big problem in our region, alcohol use disorder or alcoholism. Alcohol is toxic to the brain. So that has been known for a long time. For the past hundreds of years, people who are alcoholic were aging faster, were losing their memory faster, and were dying earlier than their counterparts who don't drink. So we know for sure alcohol is toxic to the brain. There was some theory at a certain point in the 1960s and 70s that a bit of wine is good for your brain and heart, but that's not the case anymore. All the studies show that alcohol is toxic to the brain. So it has multiple effects. So one of the first effects it has is that the alcohol, ethanol itself, damages the nerves. It damages the coverings of the nerves. It damages the DNA of the nerves. That's the first thing. Then alcoholics are at increased risk of traumatic brain injuries, because who are the people who get into accidents in most of the time in Nairobi or in anywhere in the country or in the region? They're alcoholics, young person who's drunk and driving very fast. So that's also a secondary effect of alcohol and disease of the nervous system. So the theory that a bit of alcohol is helpful for the brain has now been debunked multiple times. So we discourage alcohol consumption. For patients who already have neurological diseases, either brain tumors, traumatic brain injuries, strokes, all the nervous disease symptoms get worse if the patient drinks alcohol. Thank you.
Thank you for that, Dr. Another question is, do mental illnesses, that is depression, ADHD, bipolar, OCD, and others, have any observable neurological symptoms, or is it all psychological?
They do have, excellent question, a technical question. Those diseases, unlike the tumors and the strokes, if you do the MRI, it looks usually normal, the common MRI that you do. But if you do something called functional MRI, you always pick something. And how do these patients present? Depression, schizophrenia, mood disorders, or obsessive compulsive disorders. The problem is imbalance in some substances in the brain called serotonin, dopamine. These are neurotransmitters. Some of them go up, some of them go down, and that disbalance is what causes the mood disorders. So the observable clinical symptoms are, they present with sometimes tachycardia, insomnia, loss of weight or weight gain because they're eating a lot. So those are some of the things that we see with those patients. But if nowadays, if you do a functional MRI for a patient with, let's say, schizophrenia, it will be different from somebody who doesn't have schizophrenia. And this is new and recent finding. Yeah. So the observable symptoms are usually extra, let me say, CNS. They develop with things like tachycardia or very high rate or insomnia. Those are some of the symptoms. But if you look at it and do a neurological exam, most of them, as the question suggests, will have a normal neurological exam. They'll not have weakness on one side or slurring of speech. If you do the general exam of their motor, sensation, and reflexes, they seem to be fine. Yeah, but these patients will have either very high blood pressure because they are anxious, they are worried. So this is how we describe them. It's like someone in the forest being chased by a lion. If, let's say, for example, somebody with panic attack, okay, they are sitting in my office, there is no immediate danger, the door is open, everything is fine, but the person feels like they are being chased by a lion in the forest, only that there is no lion and there is no forest. Thank you.
Thank you very much. Another question here is electroconvulsive therapy. How effective is it towards mental illness treatment, and at what point can one be recommended to undergo an ECT?
Excellent question. So the ECTs are usually for patients with mood disorders, depression, and sometimes schizophrenia. Okay, so it's not the first line treatment for those disorders. It's not when somebody presents with major depression disorder, it's not the first treatment. The first treatment is psychotherapy, trying to change the perspective of the patient, and that is done by psychiatrists and psychologists. So let's say someone is worried about their health, but they're in good health, they're in excellent health, like a gentleman I had a few weeks ago. So the person is worried that their liver is failing or their kidney is failing, only that the liver function and the kidney function are okay. So the first line of treatment for those patients, especially with depression and mood disorders, is through psychotherapy. And if that fails, they're given medications to help with the disbalance, serotonin-containing medications. Okay? So if that fails and the person is in danger, they are maybe now suicidal, they are a threat to themselves and others, then ECT is recommended. But who are the specialists who prescribe and do the ECT? It's the psychiatrist. It can be done by anybody else. So if you are, let's say, a liver specialist, it's not your job to prescribe it or to manage a patient with those kind of issues. So it's a standard therapy. It's something that is widely used for patients with mood disorders, but it has a criteria, and that criteria is determined by the psychiatrist who's managing the patient. Yes, the effectiveness of it, there is some question. The latest report I had was like around 40% of those patients respond well. The rest don't respond well. Some will have some partial benefit, others will not have any benefit. So, but it's the best to liaise with the psychiatrist and manage in a stepwise manner, and not start with ECT, or the patient should not go and talk to the doctor and ask for ECT. Thank you.
Okay, thank you for that. There's another question here. What are the major causes of brain aneurysms? I don't know if I'm spelling it well, but brain aneurysms.
Yeah, so excellent question. One of my favorite topics, because I deal with those patients a lot of the time. So aneurysms are outpouching, and I had a very good slide and video of that. Unfortunately, I couldn't show it. So aneurysms are caused by a weakness on a blood vessel. Okay, so it's something genetic. You are born with it. It's not an acquired disease. But over time, that weakness bulges out like a balloon. So think of a pipe that is carrying pressurized water from one point to another. And then that pipe develops an outpouching or a weakness on the wall. So it slowly expands like a balloon. Okay? And one day it ruptures. Okay? So the first question is, how common are aneurysms? We know 2% of the population have it. If you bring 100 people together, 2 people have aneurysm. That doesn't mean that everybody with aneurysm will rupture. Now, if you bring 100 patients with aneurysm, 10% will rupture every year. Okay, so the rupture rate is very small. So a lot of people have aneurysms, but very few people rupture. We associate it with 2 things mainly, 3 things: female gender, smoking, and hypertension. Those 3 things cause aneurysm. If you have an aneurysm to rupture, if you are a lady, if you smoke, and if you have hypertension, the risks of your aneurysm rupturing are high. What happens when it ruptures? When an aneurysm ruptures, 15% of the patients die on the spot. they don't make it to the hospital. The 85% that make it to the hospital, if the aneurysm is not secured, okay, and it ruptures again, now 50% of those patients will die. Of all the patients who survive aneurysm rupture, it's only 30% who go back to work. So it's a terrible disease. So what causes it is genetic. The symptoms, the patient presents with the worst headache of their life. They'll tell you, I've never had this headache before. Or they present with headache and vomiting, or they present in coma because there's lots of blood in the brain. When that happens, the patient has to be taken to a hospital. And the number one thing that the doctor or the hospital need to do is to prevent another rupture of the aneurysm, which now the second rupture is lethal, it's fatal. So how do we do that? How do we secure the aneurysm? We do it by two ways. The first is to open the skull, remove the bone, open the brain, look for the vessel that has ruptured, and put an artery clip on it. Fortunately, there is a better and newer treatment, and it's called coiling of aneurysms. We don't have to open the skull, we don't have to dissect the brain. What we do nowadays is we get in from the groin, a large vessel in the groin, pass through the heart, go into the vessel that has ruptured, and put small wires called coils inside the aneurysm and stop the blood flow into the aneurysm. Fortunately, that procedure is available in the country, and we do it. The most important thing is patients to present on time. Thank you.
Thank you for that. That was very technical. I hope it helps.
I'm sorry.
Another.
If there are any questions about the technicality, please let me know.
Okay, so another question here is, what are the primary risk factors, including maternal smoking and alcohol consumptions, associated with the development of congenital neurological disorders?
Excellent question for a terrible disease. Maternal alcohol consumption, maternal smoking has been associated with lots of neurological diseases. Some of them neural tube defects, things like hydrocephalus. Hydrocephalus means there's a big chunk of fluid inside the brain. Something called spina bifida, where the spine is not covered, so the nerves are exposed. Fetal alcohol syndrome is actually a diagnosis, and it's seen in patients who are born from mothers who are alcoholics. So the baby actually develops sometimes withdrawal symptoms, because in utero they were exposed to high levels of alcohol, and now they're outside the uterus, they are not connected to the placenta, so they're not getting their doses of alcohol. So they develop alcohol withdrawal symptoms after they are born. They usually present with lots of neurological diseases. Their heads are small, they get growth retardation. The baby itself does not grow inside the uterus, so they present with low birth weights. There are a lot of issues associated with maternal alcohol consumption. Fortunately or unfortunately, the diagnosis can be made easily if you see that the mother is alcoholic and the baby is born from that. It's easy to relate the two and manage the withdrawal. So the message is, if you are a mother, if you are a lady, let me put it that way, in the reproductive period, and you're planning to get pregnant, it's not a good idea to drink or start drinking, because it directly affects the baby. Alcohol is a drug. It's addictive, and sometimes it affects the baby. Not sometimes, almost all the time it affects the baby. And by the way, there's no safe dose. There's no amount that will say this much is enough, so don't go beyond it. If you're a mother and you're pregnant, please avoid it entirely.
Thank you.
Thank you.
There's another question here. What are the success rates by age of different treatments for different types of strokes in our country? That is also applies to East African region.
Excellent. I can speak for Nairobi, at least. The success rates. So let's say a patient presents with ischemic stroke. Remember how I described ischemic stroke? Is a patient who has a vessel. There's a vessel, and the vessel gets clogged by a clot. Okay, so the clot stops the blood from moving forward. So the entire brain that is dependent on that does not get blood. So the cells die. The function of that part of the brain is lost. For Nairobi, or in Nairobi, there is treatment available for it if the patient presents within, let's say, 4 hours. You're given a medication that dissolves the clot and reopens the blood. Okay? If that fails, there is a procedure. We go and collect the clot from where it is and remove it out. And once you do that, you reestablish flow. The vessel is now open. The brain is getting perfused. The function returns. So last week, I had a patient, 84 years old man, who was okay in the morning, had breakfast with his wife, went to his shop. Then while at his shop, he developed weakness on one side, and then he couldn't talk. Okay. Fortunately, it was close to the hospital, so within 30 minutes, he was in the hospital. We gave the medication. It wasn't opening. We did a scan. We found that it's a clot. We took the patient to cath lab. We did the procedure. It's called mechanical thrombectomy, which means you remove the clot physically. We reestablished flow, and while the patient was still on the table of what the procedure table, the patient started moving their limbs. Okay, 3 days later, he walked out of the hospital. That is available in the country. What is the sad part? The sad part is patients present when that part of the brain is already dead. Okay, they present 24 hours later, 3 days later, and then you hear stories like he was okay, and then he woke up the next day and he couldn't move one side of his body and he couldn't talk. And then we took him to the local dispensary. He was given medications. He was told he has stress to go home and rest. And now they present 7 days later. There's nothing to be done at that point. The only thing to be done is physiotherapy and helping the patient live with a disability. Because you can't, even if you open the vessel at that point, the brain is already dead. So perfusing a dead brain is not helpful. The message is it's a very, very effective treatment, at least for the ischemic strokes. And what is the percentage of patients with stroke have ischemic stroke? 85% have ischemic stroke, at least in this region. We know that. So 85% of patients with stroke have ischemic stroke, and ischemic stroke is easily treatable if you present on time. Okay? So the other type is called hemorrhagic stroke. Now there's a big chunk of blood inside the brain. That causes mass effect, something called mass effect. It means it's pushing the brain against the bone. The person gets affected, they get seizures and all those things. And what was the treatment before? The treatment for this before was same thing again for the aneurysms. We used to open the head, we remove the bone, we dissect the brain, we take out the clot. Okay, it was a huge procedure. It had a lot of risks, and sometimes you could wonder, is the treatment more deadly than the disease itself? Fortunately, we don't need to do that anymore. Now what we do is we put a catheter, a small pipe inside the hematoma and drain it. So there's a small cut on the head, you make a small hole in the bone, and then you put the catheter inside. For you to do that, you need technology called navigation, neuronavigation. It gives you the GPS of the brain and where to put the catheter. So again, if you present on time and you have a big hemorrhagic stroke, we can still treat it. We can remove the entire hematoma and save the patient's life. But unfortunately, hemorrhagic strokes are more deadly than ischemic strokes. I hope I've answered that question. Stroke is something I'm a bit passionate about.
Thank you for that. There's another question here. Do mercury dental fillings affect the nervous system, or what is the effect of mercury poisoning on the nervous system?
Okay, excellent question and technical question. Mercury, lead, arsenide, cyanide, all these things affect the nervous system. And they do that by basically changing the genetic makeup of the nerves. For the dental fillings, I'm not sure exactly whether they contain mercury. And even if they contain the dosage that they contain, I'm not sure of it. But it's not a big issue at the moment. What we used to have a big problem with was exposure from pesticides that contain mercury and cyanide, which was stopped in most part of the world. And then lead pipes, the water piping that was used in the 80s and 70s, which contained lead. Those were toxic substances that can have effect on the nervous system. For the issue of the dental fillings, I'm not entirely sure of the dosage, but the good news is they are localized. They don't have access to the bloodstream. So if you are getting a tooth canal treatment, it's a localized treatment. So they make a hole inside the teeth or molar, and then they denervate it by killing the nerves that are causing the pain, and then they fill it with material that keeps it there, and they can sometimes build on it and make a fake tooth. So I'm not sure exactly how much of it is mercury, but the good news is they don't have access to the bloodstream. Remember, that's a localized treatment. So I'm not exactly sure, but I don't think it's a big concern for modern day medicine.
Okay, thank you for that. Another question here is there a way to know if someone is getting a stroke? So is there a way for someone to know if another person is getting a stroke?
Okay, excellent question. It's a good thing to be aware of what to expect or what to look for if you suspect a patient has a stroke. It's almost always predictable. If you see somebody has changed in their movements, or they're walking on one side, or one side is weak, or there's a facial droop, like one side of the face is drooping, if they can't talk, if their voice has changed, it's slurring, okay? It's not clear as it was. If they are confused, they can't know where they are, they're getting agitated, it could be a stroke. If they complain of severe headache, okay? Those are the symptoms of stroke. So look for symptoms called FAST, okay? It's facial droop, there's arm or leg weakness, okay? And then there's slurring of speech. And the next thing that you need to do is timely care, okay? You take the patient to the nearest hospital with stroke treating capacity. So there was a study done recently in the States, and they were asking the general population the symptoms of heart attack. And 90% of the people who were asked could identify heart attack. They just say the person has a chest pain on their left side, that person might be having heart attack. Very true, very correct. Unfortunately, for stroke, it wasn't straightforward. Okay, and very few could identify what a stroke looks like. So they were looking for convulsions, they were looking for patient, being in coma. They're looking for severe symptoms when they were asked about stroke. But stroke can come with, I can't move my left hand, I can't move my left leg. Okay, my face is drooping on one side. Patient is confused. Their speech is slurred. They're already having a stroke. So please move them to the next or the nearest available center. Thank you.
Okay, thank you for that. I hope that helped everybody to be proactive whenever there is some unusual, movement. Yeah. So thank you very much. There's another question here. Are there effects on an unborn child if the father abuses drugs? Are there effects on an unborn child if the father abuses drugs?
Excellent question. Excellent question. So the clinical aspect is minimal. If you are a drug abuser, let's say an alcoholic, and the father is, let's say the father is an alcoholic and his wife is pregnant, the chances of the baby inheriting those are less. Okay? The only issue is maybe the genes that have propensity for becoming an alcoholic are transmitted. But other than that, there's nothing much. Okay? You will not develop the fetal alcohol syndrome. You will not develop the congenital malformations. And the reason is because the nutrients or the development is dependent on the mother. Okay? So remember, the father's main work in this work of getting pregnant is the genetic transfer, okay, the sperm. And if you are not so sick alcoholic that you can at least transfer the genes, then the baby will not be affected that much. The issue is those babies born from alcoholic fathers have propensity to become alcoholics. There could be a genetic aspect, there could be an environmental factor. So the issue, though, is now if the father is alcoholic, how is he going to take care of the baby? So the parental responsibility will be affected, and that might affect the development of the child after they are born. But in utero, I'm not aware of any literature that shows that fathers with alcohol problem could pass on to the baby with the genetic defects.
Thank you. The next question is, what's the cause and treatment of constant muscle tremors? What's the cause and treatment of constant muscle tremors?
So, depending on age, okay, the clinical symptoms, tremors are caused by many things. So, the first one is anxiety-related tremors. Okay. Every one of us here have been anxious at some point. So when you're anxious, if you look at your fingers, they tremble. It's called fine tremor. So that's the commonest cause of tremors. The second group is something called essential tremors, which are hereditary. Some people, even when they're not anxious, they develop that fine tremors. And you tell them to pick something, they shake just before they pick.
Welcome back, Dr. You are addressing this is the second last question that we have. The cause and treatment of constant tremors. You have mentioned about anxiety. You are delving deep into the essential tremors.
Yeah, so essential tremors are familial and some people have it, and it's not a big concern. So it gets worse when they are anxious. The one that is pathological or disease-related is Parkinson's disease. So Parkinson's disease is seen in elderly patients who have tremors. It's a resting tremor. So when they're just seated, it's just like this, okay? And they also present with other symptoms like blank face, with short stature, inability to walk properly, those symptoms. So if a patient has tremors, we differentiate it into these groups. Is this anxiety related? Is it an essential tremor? Or this is early or Parkinson's disease? Yeah. So in the event that the patient has Parkinson's disease, there are medications that we give to treat that. So, and now there is some advancement, something called DBS, deep brain stimulation, which actually treats tremors. But it means you get an implant that goes into the brain where the tremors are coming from, and that gives electricity and then stops it from functioning. Therefore, the tremors go down. And unfortunately, I had a video to show that of a patient who had Parkinson's, and then got the DBS done, and then symptoms improve. So you switch on the machine, the symptoms disappear. You switch off the machine, the patient starts shaking again. So tremors, That's how we categorize them, and they are dealt with based on what causes it. Yeah. Some people, when they are anxious and they have these tremors, they take a bit of alcohol, their nerves calm down, and the tremors disappear. Some of the ways that are socially acceptable to treat anxiety-related tremors.
Oh, okay. Thank you. The last question here. What causes MG myasthenia gravis? I don't know if I've spelled it well or pronounced it well. And what's the
disease?
Okay.
Myasthenia gravis is an autoimmune disease. So as we are seated now and we are moving and we are talking, because our nerves are working on the muscles. So I am able to talk and open my eyes and close my eyes because my brain tells the muscles what to do. Okay, and with that, they use the nerves use something called neurotransmitter to tell it to the muscles. So let's say I want to open my eyes wide. And my brain has to tell the muscles of my eye to open wide. For that, the nerves require something called neurotransmitter to communicate it to the muscles, okay, so that the muscles function. In myasthenia gravis, that neurotransmitter does not function properly, okay? So the brain tells to open the eyes wide, but the eyes can't open wide because the nerves cannot communicate with the muscles. That's how myasthenia gravis happens. So it's an autoimmune issue. It's a neurotransmitter related issue, and it's a failure of the neuromuscular junction. Okay. Fortunately, there are medications for it. There is a management for it, but it's usually a difficult and chronic disease to manage.
Thank you very much. And that brings us to the last question. We'll request you to share with us the link to the video that you've just mentioned so we can share with the audience sometimes later. And this is to thank you very much for setting up time, aside time to speak with us and also speak with people from within our network. And we hope that even if this helps one person to get help in terms of be it there's a treatment, be it there's just management, it's something that brings joy to all of us as a community. Thank you very much for that. And now, if you'll mind sharing maybe your practice, well, the information on your practice, and now to let all our listeners here know that we work with Dr. Khalif, and we'll be happy to coordinate any treatment requirement, be it virtual consultation. People have joined us from Somali, people have joined us from Bungoma, people have joined us from across East Africa. If you like to access any service with Dr. Khalif's practice, we'll be happy to coordinate all that to make it easy for you to access these services. We have, if you would like to say something, then we can adjourn this later.
Thank you, Gun. Sorry for that. I think mine is to acknowledge everyone again for joining the session. Sorry, and also to acknowledge Dr. Khalif for his time. I've also shared the details on how to book on the chat. So anyone who would want to book or assist anyone who is in need of the services of a neurosurgeon, kindly feel free to reach out to us and we'll assist you to get in touch with Dr. Khalif. Dr. Khalif, over to you.
Thank you so much. Thank you, Eve, for organizing this and the whole team. I'm very grateful. We deal with those issues that we discussed and many more. So the world is becoming globalized. We probably are meeting from many places, so we don't have to actually physically meet for us to help each other. So if you can contact Eve and the team in My Health One, then we could be able to also do online consultations. I deal with brain and spine issues and peripheral nervous issues, all diseases that affect that. And we are very happy to help anyone that needs help. Thank you so much for your time.
Thank you very much, Dr. Thank you very much to Barakat Kaful and the team that joined the call with us. And we hope that this type of events will help people get that necessary help, even with the unique nature of brain diseases, brain-associated disorders, that these people or our audience and network will have that assistance. Thank you very much, and I wish you all a great afternoon for those in within East Africa. Bye.